Viewer, just bear with me as I take you through certain facts before I get you our reports today at 5 Live. No, the second wave is not over just yet. Make no mistake, we are still very much in the second wave as we speak. The second wave is not over yet, but yes, the COVID curve is slowly flattening. That is the truth. No, the death rate is not down yet, but yes, the test positivity rate is definitely down. No, Kerala has not been able to slow the spread just yet. But yes, the COVID spread has slowed in the other southern states of our country. So that's good news. No, the vaccination targets aren't being met. They are nowhere close to being met by our country. But yes, India's third vaccine, the Sputnik V, is in sight. No, the vaccine shortages are still crippling India's fight. It's the world's largest vaccination program in history. But yes, the government today has announced ramped up production of vaccines. So what I'm trying to tell you basically is that there is an absolute tsunami of bad news, but there are things that we need to hold on to with some hope for the next few weeks that we are going to get through this together. Because as the nation battles its worst health crisis, the first big glimmer of hope in many weeks comes in this COVID fight today. And it is in the form of data, which suggests that the infection rate in India is in fact slowing down. This is very good news. A reduction in the R value or the reproductive rate is below 1, indicating that infection is likely to spread slower than before. As we speak, data shows that India's R value has dropped to 0.98. It was at 1.08 on March the 5th and it climbed to a high of 1.56 in the third week of April during the big second wave surge. It has been gradually coming down since then. The R value indicates the number of people that one COVID positive person can pass on the infection to. And it has now fallen below 1 in states like Maharashtra, Delhi and Uttar Pradesh. So that's the first bit of hope and good news that I wanted to bring to you on India Today at this time. So the reproductive rate had gone up to 1.56 towards the end of April, and now we're here on the 14th of May and it has crossed that psychological barrier and fallen below the figure of 1. This is good news and it must continue. Sneha Mordani live with me for more on this. Sneha, first glimmer of good news. Now, I don't want to make it seem like, the worst is behind us. We are never going to, be too optimistic or hopeful, but it is important to recognize that this is definitely a gain. With the reproductive value falling below 1, this is something to look out for and hope that it continues, Sneha.
Yes, absolutely, Shiv. To be taken with a pinch of salt, certainly, because reproduction value is indicative of the manner in which how fast the virus is spreading. So if it's below 1, which means that one person is still infecting another one person, it definitely means that one person isn't affecting 2 or 3 or more. But that doesn't really mean that it's going to translate immediately into a massive reduction in caseload in the country. That's not happening. Also, it's indicative of the number of cases that have been recorded, which means lab tested cases and cases that have been detected positive in a lab via RT-PCR or whichever method. It doesn't take into account the unaccounted cases of COVID-19 in the country, and we know how many there are essentially. Also, an improvement in the positivity rate that the government of India is talking about. Yes, a good sign, but more than 10 states still have the positivity rate of more than 25, which means that of the 100 samples tested, 25 people are still positive. The World Health Organization says that the positivity rate in the infection has to be below 5 for us to think that we have made some gains, and I think we are very far away from achieving that 5% rate.
Okay, thanks very much, Sneha, for getting us the latest on that. So that's the reality check as far as reproductive rate is concerned. It has to be understood in that context, but definitely still something that brings some kind of hope. Now, there's some more good news coming in from the new COVID epicenter, the southern parts of India, where cases have gone down after a massive spike a huge run of new cases over the last many days. Let's start with Telangana. The cases in the state have come down, shows Health Ministry data. On the 9th of May, 4,976 cases. On the 10th of May, 4,826 cases. 11th of May, 4,801 cases. 12th, 4,723, and now on May the 13th, which was yesterday, there were 4,693 cases in a 24-hour period. So that's good news. It means it is gradually coming down. Remember, the caveat always applies as far as testing is concerned. Let's take a look at Kerala now, which has also seen a nominal dip in cases. There were 35,801 cases on May the 9th, then 27,000, then it went up to 37,290, then 43,529, and now on May 13th, once again, tentatively, it has come down to 39,955 cases. So a big spike and now slowly a nominal reduction in daily cases. More good news though, because Karnataka, remember, like we've been telling you here on India Today, has become the new epicenter of COVID in the country. Karnataka, which has seen this huge surge in COVID cases and deaths. The cases in Karnataka on May the 9th was 47,930, came down to 39,305 on May the 10th. May 11th, around the same. May 12th, a little bit more, 39,998. But the latest data shows a pretty decent reduction from 39,000 down to 35,297. So that's something to hold on to, but the crux is going to be on making sure this continues. The deaths in Karnataka have also come down in the state, so that's also a bit of good news. Take a look at this data. On May the 9th, there were 490 deaths. Next day, 596 deaths, then 480 deaths, then 516 deaths. And the latest data, May the 13th, shows 344 deaths. So 400, 500, now down to 300. Still a long way to go, but it still needs to be sustained. Nagarjun Dwarkanath is joining us live from Bengaluru. He's been reporting on the city's crisis over the last many weeks. Definitely no, sitting on these gains, Naga. Because the worst is definitely not behind us. There's a huge fight ahead of us, but some small glimmer of respite in terms of the daily caseload and the number of deaths in Karnataka today.
Well, that's true. In fact, we were touching 50,000 odd just few days back, and yesterday's data shows us that we are come down to 35,000. But that's also a cause of concern because the testing also has reduced. Yes. We were last few days we were doing around 1.7 lakh testing, and we have reduced to 1.2 odd lakhs. But however, the positivity rate also has reduced considerably. It was earlier 33-34%, and yesterday it has come down to somewhere around 27-28%. So there is still a glimmer of hope. And what the COVID task force is of an opinion that the lockdown may have to continue for another week, maybe till June 1st. Right now it's still May 24th. Another 1 week we will definitely come down to 12-13%, and the same Delhi and Maharashtra model can be put in place in Karnataka also. Remember, the many reasons that Karnataka is facing such a surge is because of untraceable patients. Positive patients have put off their phone, and now the Home Department is on field trying to find them, trying to locate them, and they are successful in certain places is what we are told. And thus, that's the reason why the numbers are also coming down, and the lockdown certainly has helped, and which will continue for the next few days.
Okay, Naga, thanks very much for getting us that. Some tentative good news in Karnataka needs to be taken very, very cautiously, but something to hold on to. Next, let's get on to the other big development today. Prime Minister Modi, while addressing the nation today, said that the government is working on a war footing to fight the second wave of COVID-19. He's expressed confidence in winning the battle. Shortly after his address today, the Union Health Ministry in a statement announced that the supply of nearly 1.9 crore vaccines free of cost to all states and union territories from May 16th to May 31st. The allocation of vaccines is being decided on consumption patterns of states and union territories. The supplies will include 1.62 crore doses of Covishield and over 29 lakh doses of India's own Covaxin. The delivery schedule for the allocation will be shared in advance to ensure rational and judicial allocation of sources and utilization. Well, this comes after several states and union territories had raised concerns over disruption in their vaccination drives due to this continuing, and let's face it, crippling shortage of vaccines in the country. But some small increase in the production of vaccine is still something that should be welcomed.
आज देश में जरूरी दवाइयों की आपूर्ति बढ़ाने पर युद्ध स्तर पर काम किया जा रहा है। सरकार और देश के फार्मा सेक्टर ने पिछले कुछ दिनों में जरूरी दवाइयों का उत्पादन कई गुना बढ़ाया है। बाहर से भी दवाइयां मंगवाई जा रही हैं।
India's third vaccine is in sight in a big boost to India's vaccination program. Dr. Reddy's has administered the first dose of Sputnik V vaccine in Hyderabad. The Russian Sputnik V from Dr. Reddy's will be priced at 948 rupees with a 5% GST. The final cost will be 995 rupees and 40 paise. Sputnik V has become the first foreign-made vaccine that is used in India, contributing to the world's largest COVID-19 vaccination campaign. The firm says that they are proud to firmly stand with India in this fierce fight against COVID-19. Inoculations with Sputnik V in Hyderabad today followed the arrival of the first batch of the vaccine in India on the 1st of May. The second batch is expected to arrive in India by the end of this week. The efficacy of Sputnik V is 97.6% based on analysis of data on the coronavirus infection rate among those in Russia vaccinated with both components of Sputnik V from December 5th to March 31st.
Sputnik V is a vaccine which, according to the government, will be made available to Indians very soon. How soon do you think people will be able to get their hands on it, and will Sputnik V be given in schools or will it be given to private players first?
So Sputnik vaccine is already there in the country. I understand about 15 million doses are already there, and from next week onwards I think distribution is going to start. Probably it might start with private sector or big hospitals, and the reason is that it requires minus 20 degree storage, although in public sector also that is possible. The other thing is, once you open the vial, the vial has to be used within 2 or 3 hours. So probably we will see, but certainly in the schools and other things it will not be. In a camp mode probably it cannot be done, or a program can decide. It can be given because if there are more than 10 people and it is to be given. But to my understanding, private sector probably will get that dose.
The first lot of Russia's Sputnik V vaccines arrived in India's Hyderabad on May 1st, but it has been more than 10 days since with no clarity on where they are. So what's caused the delay? 150,000 vaccines have been imported from Russia. Of this, 100 samples were sent to batch testing to the Central Drugs Laboratory in Kasauli, Himachal Pradesh. The protocol laid down by the Drug Controller General of India states that the manufacturer of the vaccine will be required to get every batch of the vaccine tested or released before it can be used under the National COVID-19 vaccination program. Even after 14 days, the process is not complete. Vaccine batch testing is done to test for sterility, toxicity, efficacy, or any sort of contamination of the vaccine batch, among other factors. The testing takes at least 10 days to conclude, but there could also be another reason. Sputnik V vaccine has yet not been approved by more credible drug regulators such as US FDA or WHO or even the European drug regulator. There is no word on the vaccines reaching any states either. The Delhi Health Minister also confirmed that they haven't received any communication yet on Sputnik V's supply.
2 लाख से ज्यादा करीब स्पुतनिक देश में आई है। क्या दिल्ली को कोई मिला है, कुछ मिला है या आपको कुछ बताया गया है?
अभी दिल्ली को नहीं मिली है।
Meanwhile, the government is hoping that the Russian doses will be available to the population by next week.
स्पुतनिक वैक्सीन देश में आ गया है और आज मुझे ये कहते हुए खुशी है कि अगले हफ्ते हमें उम्मीद है कि स्पुतनिक वैक्सीन विल बी अवेलेबल इन द मार्केट। जो लिमिटेड सप्लाई पहली आई है वहाँ से वो उसकी बिक्री शुरू होने की उम्मीद है अगले हफ्ते, अर्ली नेक्स्ट वीक, और उसके बाद उनकी और सप्लाईज आएंगी और फिर जुलाई के महीने से ये बनना शुरू हो जाएगा और ये सब कुछ उस पीरियड में 15.6 करोड़ तक बनने का एस्टीमेट है फ्रॉम द कंपनी।
With Milan Sharma, Bureau Report, India Today.
Milan Sharma, who's with us live and has been tracking the journey of the Sputnik V, is live with me. Milan, welcome. Break it down for us very specifically, Milan. When can Indians expect to start receiving Sputnik V shots? The first shots were symbolically administered today in Hyderabad. When's it going to ramp up and become the big thing here?
Well, thank you, Shiv. In fact, that is the very important question that everyone wants to know. There was a batch testing that was happening for the previous lot that came to India on May 1st. That batch was tested in Himachal Pradesh and Kasauli. That delayed it. But now the second batch has come. The approval has been given from there. Initially, we know from our sources that the vaccine will be available mostly in private facilities across the country. So we're looking at a batch in Hyderabad. It could be distributed to a few private facilities because of the temperature at which the vaccine is stored. Remember, it's stored at -18 degrees. And after that, we'll have more doses. But right now, let me tell you, the two batches that have landed in India are imported, and there are about 3 lakh doses in all. So that's a very small number in the country right now. And the production with the 5 companies will begin only from July. But then we will be expecting somewhere about 85 odd crore doses. But right now, Shiv, it will take a few more weeks until such time a common man in India could pay for these shots and access them. Since they'll be available only mostly in private facilities, the price has been fixed by Dr. Reddy's in India. It's above 900 rupees. So we'll have to wait and see what the private facilities want to charge for it, along with their additional cost to the vaccine. And then the persons will be able to access it.
Okay, very clear. Milan, thank you very much for clarifying that for us. We'll keep coming back to you for those updates because people are holding on to any information they possibly can that gives them hope of faster vaccine arrivals in the country. Prime Minister Modi issued a stern warning today to virus vultures. Remember, there has been a lot of criticism. People have been saying, why isn't the Prime Minister addressing the country? Today, he addressed farmers. During that speech, he highlighted how some people were trying to profit from the pandemic. The Prime Minister warned virus vultures, saying those black marketing drugs or trying to mint money in the country will face strict action. He also urged states to crack the whip on such profiteers. Here's what the Prime Minister said, his first words during the second wave.
इस संकट के समय में दवाइयां और जरूरी वस्तुओं की जमाखोरी और कालाबाजारी में भी कुछ लोग अपने निहित स्वार्थ के कारण लगे हुए हैं। मैं राज्य सरकारों से आग्रह करूंगा कि ऐसे लोगों पर कठोर से कठोर कार्रवाई की जाए। ये मानवता के खिलाफ का कृत्य है।
And I also wanted to tell you, viewers, you'll be very happy to know that amidst all this devastation, those of us who can show some humanity within our remit, within our sphere of influence, are doing so. India Today came to the rescue of a hapless father and a newborn baby girl in Hyderabad yesterday, both of whom were forced to wait outside the Gandhi hospital in the city where the COVID-positive mother was admitted. Here is India Today's Ashish and what he did for this little family.
A 5-day-old infant, a COVID-positive mother, and a hapless father, forced to wait outside the Gandhi hospital in Hyderabad with his newborn girl. The infant is only surviving on warm water and milk powder as her mother battles coronavirus in the same hospital where she gave birth.
Behind me is a father waiting outside this COVID-19 dedicated hospital of Hyderabad, the Gandhi hospital, hoping that the mother of this 5-day-old child recover fast so that she can come out and feed this hungry baby.
20-year-old Krishna is a farm laborer and along with his mother is trying his best to take care of his baby girl. The father had no option but to wait outside the hospital because neither could he afford accommodation in the city, nor could he go back home to Zahirabad, 115 kilometers from Hyderabad.
इधर कहीं को बैठे आप?
क्या करना, मुसीबत में बैठे हैं सर।
क्यों मुसीबत है?
क्या उसका अम्मा का इलाज तो होना ना, उसका अम्मा का इलाज भी नहीं है, कुछ नहीं है। उसको लेको जाओ बोल तो वो लाजन की कैसा लेको जाना, सुबह में तो लेको जाना उसके।
Fearing that someone might steal the baby, Krishna chose not to stay at the shelter home. After knowing of their plight, India Today arranged for help an ambulance and sent the father baby and her grandmother back to their village. As staying outside the hospital in this pandemic is not safe for the family and especially for the newborn. We at India Today wish that the baby remains hale and hearty and is soon reunited with her mother. With Ashish in Hyderabad, Bureau Report, India Today.
And as experts ring alarm bells of children being at the highest possible risk in the possible third COVID wave, a group of school students in Delhi have come together to kickstart a tweetathon on social media, urging the government to please vaccinate children as quickly as possible. Here's what they're doing.
In the midst of a deadly second wave across the country and a looming threat of a third wave that experts warn could hit the children most, chorus is growing across the country for vaccinating those below 18 years of age. For this, a bunch of young minds have started a social media campaign. What started as a small initiative has now gone viral, with parents and professionals from across the country joining it to make it a top trend.
I was sitting at home watching the news with my mother, and I saw these vaccination drives for people above the age of 18. And I wondered why the government isn't starting a parallel drive, a parallel vaccination drive for children between 12 to 17 ages as well. My mom told me it wasn't determined when we could actually get vaccinated. It could be in a year, it could be in a half a year. So I decided to actually make an effort. I reached out to interested friends, and through our aunts and uncles and our parents, we basically spread the word. And the amount of feedback and support we received was much more than what we had actually expected.
The campaign has gathered steam, with more than 20 WhatsApp groups being run by students. A tweetathon with hashtags like Save Kids from Third Wave, hashtag Vaccine for Indian Kids, and hashtag Pfizer for Indian Kids has been trending on Twitter.
We as kids need to get vaccinated now. I see the government making all these, having all these vaccination drives for adults above the age of 18. So this movement was basically created to request the government to start a vaccination drive for kids as well. Now with this possibility of a third COVID wave coming, as well as this current strain of COVID affecting children more adversely than what did in the previous waves, why should we wait for a time where a COVID strain affects children even more than what it does now? Why shouldn't we push for action as soon as possible?
The tweetathon is to urge the government to explore options of vaccinating the kids with Pfizer jabs that have already been declared safe for children below 18 in the United States.
We chose Pfizer to streamline the movement because specificity is better than generalization. Our main aim is just to make sure that 12 to 17-year-olds are included in the list of those being vaccinated, and we don't wait for the third wave to affect us.
With more than 41% of country's population below the age of 18, these children have hit a raw nerve. They are urging the government to save young lives before it's too late. With Mosme Singh in Delhi, Bureau Report, India Today.
And coming up next, a reality check. We've shown you these 5 stories of hope, but let's remind you that the horror is nowhere close to being over. We take you to the